Metabolic psychiatry. Can you start talking about this and maybe start by what are some examples of how you and your practice have successfully treated some kind of significant, mental issue that someone has had using primarily or exclusively a dietary as opposed to a pharmacological approach?
Yeah, many, many examples in my own work. I've included quite a few examples in the book as well. And I've done research on this, and I helped publish a paper a couple of years ago on this as well. Lots of examples I could give. So I'll give an example from my own practice, and then I'll give an example from the study that we published. So for example, in my own practice, like I said, there are examples in the book, but I'll give an example that's not in the book, just in case people already read the book and want a new example. So there's a woman in her 70s I've been working with for, I think, about 4 years now, at least. Chronic, so 40 plus years of recurrent manic episodes, essentially psychiatrically disabled from these recurrent manic episodes, which required hospitalization twice a year, often for several months at a time, and lots of psychiatric medications over the years that helped very little, did not prevent these hospitalizations and these recurrent manic episodes. So she consulted with me. Her daughter actually got in touch with me a few years ago and said, and she was eating a ketogenic diet for her own reasons, for different health reasons. And she had heard about metabolic psychiatry. She said, do you think a ketogenic diet might be able to help my mom with her mental health? And I honestly had no idea whether, especially in a case like this, where someone had, decades long history of serious mental illness of this degree that had been this, quote, treatment resistant. I honestly didn't know what was possible, and I really never know what's possible. So I said, I don't know what's possible, but we're certainly worth a try. And so this lovely woman, she very cheerfully and willingly adopted this ketogenic diet and followed it to the letter. By the end of 2 weeks, so many of her, she was no longer paranoid. She was no longer anxious. She was waking up 3 hours earlier, able to be more functional throughout the day. And we were over the course of the next 4 months, her psychiatric medications were able to come down dramatically, including she was able to come completely off one of her antipsychotic medications. She was able to come almost completely off a second very powerful antipsychotic medication, and she was able to come completely off a third medication, which was an antidepressant mood stabilizer. And she continues to follow the diet to this day. We're still working together, and she's still she used to be hospitalized twice a year, um, pretty much like clockwork for decades. And over the past 4 years, she's been hospitalized only twice. And so this is a wonderful example of it really is never too late, and the situation is almost never too serious to benefit substantially from a ketogenic diet.
So that sounds so she was suffering from manic episodes. She was on antipsychotics and several medications. I don't know the details here, but I know that some work has been published recently looking at the ketogenic diet for bipolar disorder.
Yeah.
What's known there, and is this something that we're seeing repeated success with in many people?
Yeah, so there are three studies worth mentioning in this area. All have been published in really since the summer of 2022. I'm telling you, this area is really a very rich area of research, tremendous promise, wonderful results from all three of these studies, and the research is exploding in this area, not just in bipolar disorder, but in other serious mental illnesses. So I'll give a quick example, a quick summary of each one of these studies because they're all really important and so exciting. One of them was just published last week. So the first study is a study that I helped to publish. It was a study conducted in Toulouse, France, by my friend and colleague, Dr. Albert Denat, psychiatrist in Toulouse, practicing now for more than 35 years. He invited 31 of his most so-called treatment-resistant patients with chronic schizophrenia, bipolar disorder, or severe major depression into the hospital as volunteers to try a whole foods, mildly ketogenic diet under his supervision to see if it would help them. These were patients who had been ill for an average of 10 years, some for as long as 30 years. They were taking, at the time of admission, an average of 5 psychiatric medications, almost all of them taking at least one antipsychotic medication, and all of them had at least one marker of poor metabolic health. And none of them were doing well. And he had really run out of ideas for how to help them. They were receiving attentive psychotherapy, medication management. They'd been hospitalized many times before already. In this case, 28 of the 31 patients were able to stay on the diet for longer than 2 weeks, which is what you need to do to start to see results. Every single one of those 28 patients improved and improved substantially. 43% of them achieved clinical remission from their primary psychiatric diagnosis. 64% of them left the hospital on less psychiatric medication. And so, and most of them lost a clinically meaningful amount of weight despite taking these medications, these antipsychotic medications, which are notorious for causing substantial and
Yeah.
very stubborn weight gain.
Okay, so they lost weight despite weight gain being a side effect of many of those medications. You said it was a
Yes.
mildly ketogenic diet. What exactly does mild mean?
Yeah, so there are different degrees. There are different degrees of ketogenic diets. There are sort of relaxed ketogenic diets where the carbohydrates are restricted, but you might not restrict protein to the same degree. You might not restrict the amount of calories that are coming in, right? So
Mhm.
it's kind of a more relaxed diet. It's not designed to get
But it's
ketones
it's still
very high.
ultra low carbohydrate.
Yes, in this case, it was 20 grams of carbohydrate or less per day.
Mhm.
Um, and there was a ceiling placed on protein, but when I say mildly ketogenic diet, what I mean is that when these patients were tested by urine testing, which is what they had available in this particular clinic, they were just a low level of ketones on
Mhm.
the strips. So there are also very strict ketogenic diets, which were originally developed back in 1921 for the treatment of pediatric epilepsy. These were very deeply ketogenic diets where ketone levels were very, very high. And the diets had to be not just restricted in carbohydrate, but also restricted in protein in order to get the ketone levels up to those very high levels. So this was a mildly ketogenic diet, meaning it wasn't hard to follow. It didn't require protein restriction, it was a fairly liberal
Mhm.
ketogenic diet, but still ketogenic.
And this French study that you mentioned, it was a mixed population, and you said it included people with schizophrenia.
Yes. Mhm.
So even something like schizophrenia, which we often think of as one of the more severe mental health issues someone can have, people are seeing significant results with that.
Yes, absolutely. And so in this group of people, not only did did their psychotic symptoms improve, but they improved substantially. The degree of benefit that people experienced with this ketogenic diet in terms of their psychotic symptoms was 7 times more benefit, more improvement in their symptoms than we see in studies of antipsychotic medications.
How are you starting to think about the why here? Why would such a wide range of psychiatric illnesses respond to going into this ketogenic metabolic regime?
Yeah, so and I think this really speaks to the power and the promise of ketogenic diets for all kinds of health conditions, brain as well as bodily health conditions. It is because when we're in a state of ketosis, um, lots of different pathways and lots of different operations in the brain work better. Ketones burn more cleanly, more efficiently, with less inflammation and less oxidative stress. And when you're not eating a high sugar, high insulin, high vegetable oil diet, when you're not eating all these damaging, destabilizing ingredients, which damage the brain from the inside out, when you quiet all that down, you focus on whole foods, you get your glucose levels down, you get your insulin levels down, everything can quiet down and you can kind of restore peace to the village, so to speak. The whole brain works better when it's not in this high glucose, high vegetable oil, high insulin state most of the time. So of course it makes sense to consider this intervention almost regardless of the diagnosis. I mean, I think really the only diagnosis I might caution people against using this or considering using this intervention with is underweight anorexia. Just really, we've seen benefits in our clinical experience and in published case reports and in some of these early trials in just about every psychiatric condition that's been looked at so far.
So, the ketogenic diet, very interesting, often very difficult to maintain. Let's assume someone's listening and they don't think, or they're not willing to try to permanently stay on a ketogenic diet. Do you like, what are some of your recommendations or guidelines there? Like, do you think people should be trying to go into ketosis once or twice a week through intermittent fasting? How do you think about ketosis for people that don't want to stay permanently on a ketogenic diet?
Okay, great. So one of my goals in the book, I didn't want the book just to be about ketogenic diets because for so many people, even just the word ketogenic is a non-starter, right? There are some people who will not consider this, don't want to try it, and I understand that. And not everybody needs to. Not everybody needs to follow a ketogenic diet to reap multiple brain health benefits through dietary changes. There are lots of other changes you can make to your diet that don't require going into ketosis that can improve brain health. For example, just taking the refined carbohydrates and vegetable oils and all the ultra-processed foods out of the diet, which all of us should do anyway, it's a huge step in the right direction. And for some people, just following these whole foods principles is all they need to do to quiet things down and recover. However, if that's not useful enough to you, you may need to start to explore other changes. You might need to cut back on the amount of carbohydrate in your diet. You may even need to go to a ketogenic level of carbohydrate restriction. Everybody's different in terms of their metabolic health. So in the book, I've got different levels of dietary strategies that people can try. And the first one it's a paleo diet that has 90 grams of carbohydrate per day in it. So it allows you to have a serving of, starch or fruit or whatever you like.
What's the average American at right now in terms of grams per day?
Over 300.
Over 300. Okay.
Yeah.
Okay.
Yeah.
So 90 grams a day on this one. And
yep. So it's a paleo diet, but it's got a lower carbohydrate than where a standard paleo diet, say like the Whole30, which is a wonderful diet. A standard paleo diet or hunter-gatherer diet puts no ceiling on anything. So you can have as much of those whole foods, meats and poultry and eggs and fish and nuts and seeds and fruits and vegetables. You can have as much of those foods, you just eat to satiety. Now, the reason why I recommend 90 grams of carbohydrate is because most of us do now have some degree of insulin resistance, meaning that's our ability to safely process large amounts of carbohydrate is somewhat impaired. And so if you don't cut back on that, you may not see the same good results. So I recommend this, moderate carbohydrate paleo diet as step one. If that doesn't help enough, then you can explore, if you wish, lowering the carbohydrate even further, even down into the ketogenic range, which is step two. And then there's even a third option for people who don't get enough benefit from those two strategies or have a lot of unexplained or chronic health issues, autoimmune conditions, gut sensitivities, food sensitivities, gut health issues. For people who really are struggling with a lot of mysterious health conditions or stubborn health conditions, they may even want to explore, at least temporarily, carnivore, plant-free carnivore diet, at least for a short period of time. So there are these different levels of engagement with dietary strategies that people can explore. And another thing I would say to people who say, well, oh my gosh, I could never be on a ketogenic diet for the rest of my life. I never, never, never with any patient say, we're going to do this for the rest of your life. What I say is, I would encourage you to try it for 6 to 12 weeks to see what it feels like, and then decide whether or not you want to continue on it a little longer. Because if you've never tried it, it can be a really eye-opening experience. It's a completely different state of mind. Often people don't recognize their own feelings, their own thoughts, their own behaviors when they're in that different metabolic state. So I think everybody deserves to experience that and then decide what they'd like to do longer term.
So for your recommendation around the carnivore diet, it's pretty generic recommendation. People are just sort of generally feeling like a little off or whatever. You can sometimes recommend that to them. How much of that diet is is the benefit coming from the carnivore per se, or is it coming from the elimination of all of the other unknowns?
It's probably both.
Mm-hmm.
It's really anybody's guess. But I do think that it's both because I personally and have a lot of clinical experience with this as well, using different dietary strategies within the same individual, sort of graduating people through these different steps. And it's interesting, a lot of people might say, well, maybe the benefit to the carnivore diet is just that it has zero carbohydrate in it. So maybe it's just like ultra ketogenic, right? So
Mm.
it's because it's not just low carb, it's no carb. That must be the magic to it. But the interesting thing is that there have been quite a few people, including myself, who have spent a long time on a very low plant ketogenic diet. Good ketones for long periods of time, experienced lots of benefits, and then we switch to a plant-free carnivore diet. The ketones may or may not be higher. Sometimes they're actually lower, and there are there are significant additional benefits to that diet, even if the ketones are not as high. There's something else happening with a plant-free diet that seems to go beyond the metabolic piece to perhaps the nutritional piece and the elimination of toxins and anti-nutrients and so forth.
And is that when you say that, is that based on like patients telling you they feel better? Is it based on like lower inflammatory markers that you measure? Where's that coming from?
Yeah, so in my clinical work, it's coming obviously from people's reported experiences and my sort of experience with them. There's no formal research yet of any rigor in terms of controlled trials or even small clinical trials, prospective clinical trials um, on carnivore diets yet. They are coming, but we don't have these yet. So right now we just got lots and lots of people experimenting with their diet and experiencing these benefits and reporting them. We do have some nicely documented case reports in the literature, and I've included some of those in the book, showing that there have been some people who have really, experienced remarkable healing and recovery from even some very serious autoimmune conditions on carnivore diets, tremendous benefits in certain types of cancer, autoimmune conditions like type 1 diabetes. It really can be pretty remarkable. These are isolated cases.
Mhm.
And so we do need more research in this area. There was, in fact, just a fascinating paper, three very well documented cases of people who had suffered with severe anorexia, with BMI, normal BMI, that's a measure of body size, BMI down as low as below 11, whereas a normal BMI would be 19 or higher. So very, very seriously, gravely ill, who fully recovered, all three of them independently, fully recovered from severe anorexia, life-threatening anorexia, on a plant-free carnivore diet and have remained in remission. Each have gained more than 40 pounds each and sustained remission for 1 to 5 years now and counting. So there are this diet is one of those diets that has some interesting properties that we don't yet fully understand.
And so, based on everything that you've seen with the carnivore diet, and I know there's many people have tried this at this point. So there's lots and lots of anecdotes out there. Many different physicians like you have directly seen what people have done with this diet. How do you get all of your vitamins and minerals? Do you need to supplement, or can you get basically everything you need from whole foods on a carnivore diet?
It's an area of controversy. So I've included information. I've addressed this in the book. There's a whole chapter about carnivore diets in the book, and addresses this question. So a fascinating difference between plants and animals that a lot of people may not know is that it is absolutely 100% impossible to get all of your nutrients from plants because there are certain nutrients that plants simply do not contain that are essential for humans. It is theoretically possible to obtain all of your nutrients from animal foods. It is theoretically possible. Is it in real life possible? Are there actual risks? Are we getting enough of them? If you eat the right mix of animal foods, and what is the right mix of animal foods? How much of these nutrients do we actually need? All of these questions are being explored, but theoretically, it is possible. You can find all the nutrients you need in animal foods. The question is, how much of them do we need, and are we getting enough? And does it matter what the mix of animal foods is?
Mhm. I mean, it sounds like based on everything that you've told me, you would recommend anyone, whether they're metabolically healthy, whether they have a mental illness, whether they're just an average person, that you would probably recommend minimizing refined grains and vegetable oils.
I would recommend removing them to the extent that you possibly can, as much as you as humanly possible.
Can you reiterate a little bit on why that is? I know that we've already covered it, but it can't hurt to reiterate it. And then talk about that in the context of, that more or less directly disagrees with what the official dietary guidelines would say, right? Get a lot of whole grains, get a lot of this stuff. What do you make of that?
Yeah, so all of those recommendations, the recommendation for there's so many nutrition myths which stand in the way of your good physical and mental health. And one of them is that we need whole grains at all. Not just that, and they're not just unhealthy for you. We don't need them at all. And so we don't need them, and they're actually working against you. And the reason why we hear all the time that whole grains are healthy for us is that the studies that demonstrate this are comparing diets that contain whole grains to diets that contain refined grains. Now, of
Mm-hmm.
course, whole grains are going to win every single time in that fight. We're not comparing diets that contain whole grains to diets that don't contain any grain at all. So we're not asking the question. We're not asking the right question, right? So whole grains, when you actually look at what they are, if we stand back and dispassionately, objectively explore what's actually in them, they have almost none of the nutrients that we need, and
Mm-hmm.
they're loaded with anti-nutrients and toxins, and they're very difficult to digest, and they're toxic unless you cook them and process them to a certain degree. You
Mm-hmm.
will get very sick if you eat whole grains as is.
Mm-hmm.
So many red flags there. So so I recommend that everybody for best health, and I've got this little diagram in the book that kind of shows you how you want to build your diet for optimal health. You want the core of your diet to be non-dairy animal foods. How much of those you eat, is an open question. I make some recommendations, but the core, you do need to include at least some non-dairy animal foods in your diet to meet all of your nutrient requirements. And then the next layer of the diet are the fruits and vegetables that you tolerate, meaning the ones that don't bother you, that you digest easily, and that don't exceed your personal carbohydrate threshold. And then, and going beyond that, the further out you go, the less nutritious and more risky you get.
Mm-hmm.
So yes, that's what I recommend.
Non-starchy vegetables. What are some of the ones in your experience that are the least problematic in general?
Yeah, so the least problematic are the non-nightshade fruit vegetables. So these are vegetables that are actually, these are fruits in disguise. So these are vegetables that contain seeds. So cucumbers, for example, it's a good example. So these are low sugar, low starch. We call them vegetables, but they're actually fruits because they contain seeds. These are olives, cucumbers, zucchini, things like that. The non-nightshades, because there are some nightshade fruit vegetables, peppers and tomatoes. They contain seeds, but they're also nightshades. So I do warn people to at least consider that they may be working against them if they have a mental health issue, at least worth exploring. So because the plant, especially if the plant needs you to help you disperse its seeds, is going to put many fewer toxins in that part of its body because it doesn't want to poison its transport system.
Mm-hmm.
So the fruits of plants are often, but not always, the least toxic part of the plant. And the seeds, the grains, beans, nuts, and seeds of the plant, those are often, but not always, the most toxic and heavily defended parts of the plant.